Yeah, so Promise is a 5-year Wellcome Trust funded research project. It's led from the University of Edinburgh. The local principal investigator here is Professor Lucinda Manda-Taylor at the Kamuzu University of Health Sciences.
Promise stands for Psychosis Recovery Orientation in Malawi by Improving Services and Engagement. Promise is a study that aims to develop an intervention that will serve as a tool for health surveillance assistance to be able to use the detection and management system of people who are living with psychosis in their communities and set them along the appropriate pathway to care. The reason why we are interested in developing and designing this intervention is that we realize that there are a lot of lost members of society in Malawi who are suffering in silence with mental health problems. And so through the 5-year span of this project, we aim to engage a variety of stakeholders and a number of individuals using different research approaches in the form of interviews, in the form of focus group discussions, as well as surveys, including workshops like the Theory of Change workshop, in order that we are able to be provided with the right information or information that is suitable and appropriate that can help us assemble a tool that will be used to detect people living with psychosis.
Mavuto amakumana nawo ambiri ena mwa mavuto ndi kusalidwa anthu aja amasalidwa kwambiri chifukwa chakuti anthu ambiri sadzindikira kuti amene aja ndi matenda malo mwake amangu aona ngati kuti mwina anthu mene amanena mayina achipongwe amisala osafuna kuti amvetsetse ndiye vuto limene lakusalidwalo ndi lalikulu kwambiri pakati pa anthu amene ajawo.
Dzina langa ndine Steven Nkoma, ndimakhala m'dera lomwe la Chitazulu. Pamene ndimagwira ntchito ndimapanga za mechanics ndimayendesa magalimoto mwawo. Ndipo nthawi imene atazapezeka kuti ndapezeka ndi vuto limene nditadwala, ndinapezeka kuti ndakhala kufa for 2 years ndikupeza mavuto limene, koma tayamba kupeza chithandizo ndaya pamene ndinapano kupeza bwino kubamba kugwira bwino ntchito. Chithandizo changa chimene ndinayambira kulandira kunali kuChitazulu, mapezeka kuti ayi anthu enaso pamene ndinapeza dokta wina ndakuti atadikira ndikuthandize ndamandithandize. Pamene ndinazamtengerano nthawi pamene ndinazadzindikira mpitawo nditaitanidwa no kuchipatala anthu abalera kuti tumachungowesa kaikupita tikaone kuti brain yake ili motani. Ndi pamene amandiuza kuti amakhala amene watu ndafunika kungotani muzichita ngati kuno mutizipeza nawo chithandizo chake muzitizi kupasa noma ngati kulibe chithandizo muzipita kuti ku ma private mukufufuza. Challenges amene ndimakumana nawo kuti pena mungakhala kuti ndibe chilichonse ndimapezeka kuti ndiyesesese ndekha ndithamange pamene nthawi imene ndikudwalamo, koma ndimapezeka kuti ndisibesizi kuyendayo, koma chithandizo ndechimapezeka kuti ndikuchilephera kuti ndipeze mankhwala. Ndipezeka kuti anthu ena ndi amene paderano ndamatha kuti tatiyese kundithandiza kugula mankhwala.
Nthawi imene ndimadwala ine ndimakumana ndi ziphinjo kuti mutu umapweteka kwambiri, mwina mtima kuthamanga, komanso ndimasowa mtendere nakuna kuti mwina mwake ndingagwire ntchito ndingangomwe achikhalire. Ndinadwalapo ndinadwalapo inali miyezi 7 ndikudwala. Tayesesa kupita mwina mwasing'anga kupita mapemphero. Nthawi imene ndinali yosazindikira simatsutso kuti chenicheni ndi chani, komana nditenga ndalama anga ajosamu amene amagwira ntchito mchipatala mumo kuti tiye kukakumana ndi atanda adokotala. Atandiona nimene amala kuti mwina mwange zitha kukhala kuti chiyambi chani cha matenda a maganizo a ubongo. Imene ndinakatenga mankhwala amene ndimamwaje mpaka napano. Koma china chonse chimene ndimapanga mwina nthawi imeneyo sindingagwira ntchito ndingangokhala, koma apa ndinayambe kumwa mankhwala amene ndinayambagwira ntchito. Poti china chilichonse apapa palibenso chimene chimandivuta apa ndinachita ndi bwino.
So psychosis is an illness that is considered a severe mental illness It affects several areas of a person's thought processes as well as behaviors. So people, for example, might hear things that others can't hear, and other people, because of that, they might experience them as somebody who's talking to themselves, whilst for them they're actually hearing voices. They might see things that others can't see, so they might react in a certain way, for example, run away from something that other people can't see, or they might behave in a strange way, or what might appear to be strange to others. So, for example, maybe walk out in public whilst naked, or wear so many different clothes, and sometimes they might speak in a language that seems strange to others. I work with people that are living with psychosis. So in my day-to-day interactions, I could say I'm an expert by profession, but also know that people with lived experience are experts by experience. So I think that I could bring that expertise from a professional level, whilst also acknowledging the expertise from people with lived experience, and hoping that together then we can come up with a good theory of change sort of map that we can use in the research.
There are a lot of challenges, but I can just select a few. The first one is late coming, reporting to the clinic. Most of the patients, they report to the clinic very late. They sort out the other means of healing, like the traditional healing. They go to the religious readers, then thereafter is when they come to our hospital.
So theory of change basically is a process where you bring together stakeholders in order to, let's say, map out how you can actually deal with a particular issue or problem. So this is actually based on people's experiences, understanding or knowledge about that particular problem, and then how within their contexts they believe that they could actually manage to deal with that problem. So it's really a process that is actually meant towards realizing or actually discovering the appropriate ways to deal with a particular problem.
So the aim of this project is to develop a sustainable detection and management tool for psychosis in Malawi, targeting 3 districts, starting with Salima and Chirazulu. Finally, we'll go to Nchewu. So we'd like to know what the project should achieve related to psychosis. What should be the end goal? What do people want to change, or what do people want the project to achieve? We have different stakeholders that are affected by this issue of psychosis. We have, for example, health workers. We have representatives from the government, from the DC. We have traditional healers. We have religious leaders. We have users, mental health users, people who have suffered from psychosis or suffering from psychosis, and their carers. So they are all here to discuss, to develop this TOC map, right, which we are going to follow as a project, right, to be together and discuss what needs to happen and what the steps that should be there to achieve that goal.
Yeah, I think a person like me, being a pharmacist, I think we're looking at issues of barriers, the barriers that affect delivery of service delivery, so to say. So barriers like availability of medicines and medical supplies, pretty much medicines to treat the mental illnesses. So after identifying the barriers, we're able also to develop, the strategies on how to address those barriers.
So PROMISE study is an interesting one, and I think it's come at a great time. When you look at the provision of mental health services in the country, it's skewed. It's skewed in the sense that a lot of resources are put at tertiary level. So you've got the Zomba Mental Hospital, a lot of resources there, which is appropriate, but only about 400 people for the whole country are able to access services. St. John of God, smaller numbers of people. But when you consider the prevalence of psychosis, for example, it's 1%. if you can count how many millions of people there are in Malawi, it means that the majority of people with psychosis will never access services at Zomba Mental Hospital. So the strategy of the government in the Health Strategic Plan 3 is to try and increase access to services. And part of it is to say we need to start having services from community level, so at health center level, district level, and central level. And the PROMISE study fits in perfectly with this strategy, in the sense that in this study we are looking at working with people right from the community, working with people that have suffered from mental illness, working with health surveillance assistants who work within the community, and then the primary workers, the chiefs, the community. So it's a dynamic study, I would say, because it fits in perfectly, and hopefully by the end of 5 years we can have a model which the country can actually adopt, whereby you have services accessible at health center or primary level, you have workers in the community aware of the illness and able to refer patients to the health center, you have proper structures or services at district level, and in this case will allow the majority of people with psychosis to access care at the community level or at district level, which invariably will, well, it will help them to get better, but it will also help to reduce the stigma that's associated with the illness.